Hello, my name is Angelica Ayra-Soto, and today we will be reviewing the dental office emergency, Syncope. So we have a patient who has arrived nervous and anxious. They state that this is their first dental appointment in years. Their chief complaint is a toothache that is so painful it has kept them up all night. The hygienist proceeds to clean their teeth and the patient experiences syncope. My patient today is Miss Zara. When she arrives, I could tell she is nervous and shows signs of anxiety. When going through her medical history, she tells me it's her first dental appointment in years. She proceeds to tell me she has a bad toothache that hurts so much it keeps her awake at night. After taking vitals, we proceed with the cleaning. I can tell something is not okay with Zara by her body language. She is starting to have shortness of breath and a pale appearance and complains she is feeling weak. She is starting to sweat, her pupils are dilating, and she has goosebumps. She tells me she is getting dizzy and nauseous and keeps yawning. I notice these are signs of pre-syncope. By this time, I have stopped any dental treatment I was doing, remained calm, and proceed to call for help from a fellow coworker to get the oxygen tank. I lay Zara in a Trendelenburg position when suddenly she has lost consciousness. I administer oxygen at a rate of 4 to 6 liters per minute. I monitor her circulation by recording her blood pressure and pulse. I loosen any tight clothing and apply a cold compress on her forehead, or I could put it in the back of her neck. Due to her having an abrupt return of consciousness and the signs of anxiety prior to her fainting, I have determined this was a neurocardiac syncope episode. If she would have remained unconscious, emergency medical service would need to be contacted because it could have been a cardiac syncope episode, which is dangerous since it's associated with underlying heart diseases. I monitor her vitals one last time and decide that the best option right now is to reschedule the appointment. It's important for the next appointment to be an early morning appointment. Syncope is defined as an abrupt, transient loss of consciousness and postural tone with spontaneous recovery. Most often, it is caused by loss of cerebral oxygenation and perfusion, referred to as cerebral ischemic. Syncope can be classified into one of three categories: neurocardiac syncope, non-cardiac syncope, and cardiac syncope. I'll be going over each in the next few slides. Neurocardiac syncope actually has multiple different names. It could be referred to as the vasodepressor syncope, vasovagal syncope, neurocardiogenic syncope, or neurally mediated syncope. This is the most common form of syncope and is the most common that we will see in the dental office. It is caused by a noxious stimuli such as pain, fear, stress, anxiety, exhaustion, or even an acute illness. It's actually pretty common in the dental office that syncope is induced by the sight of blood or by the sight of the dental anesthetic syringe. So the initial response is the activation of the sympathetic division or the fight or flight response. So there is a release of the catecholamines epinephrine and norepinephrine into the circulatory system, which produces an increase in blood flow. The blood gets pumped back into the heart, but due to the patient remaining seated and still, the blood either remains in the peripheral blood vessels or pulls to the extremities. This causes a hypotensive response and decreases the blood supply to the brain, leading to syncope. Non-cardiac syncope can be caused from seizures, orthostatic hypotension, situational occurrences, hyperventilation, or metabolic diseases. And then there's cardiac syncope, which is actually the second most common type of syncope. It results from inadequate cardiac output and occurs as a result of a serious underlying heart disease. If there is a left ventricular obstruction, a right ventricular obstruction, or other myocardial diseases, then it would be referred to as an obstructive or mechanical syncope. The left ventricular obstruction would be the most common though. This form is a very serious condition and actually can be fatal. There are several signs and symptoms that the patient will experience several minutes before actual loss of consciousness. These are referred to as pre-syncope signs and symptoms and are the body's response due to the sympathetic nervous system. On the chart that is provided, majority of it is pretty self-explanatory, but I will point out a few to just kind of describe to make it a little bit easier to know what those terms mean. So pallor means the pale appearance. Diaphoresis means sweating, and piloerection is another name for goosebumps. So when a patient is experiencing syncope, you want to immediately stop any dental procedures and remove any objects from their mouth. You will place the patient in a supine position with their feet slightly elevated, also known as a Trendelenburg position. You will need to keep their airway open and administer oxygen at 4 to 6 liters per minute. You should loosen any restricting or tight clothing like belts to allow better circulation of their blood. You will monitor their vitals throughout the episode. The vitals you're going to monitor and record are going to be their blood pressure and pulse. Additional procedures could be placing cold compress on their forehead or back of neck. Syncope should only last seconds to several minutes, so if this episode is lasting longer, the patient is at risk of experiencing a seizure due to the lack of oxygen being transferred to their brain. If this is happening, an EMS needs to be contacted. So just a side note, it is no longer recommended to use ammonia inhalants due to the potential spinal injury. It could also trigger asthma attacks or it can cause an allergic reaction. Some preventative procedures for syncope would be to schedule the appointments early in the morning. You can administer oxygen via a nasal cannula during the appointments. You could also use nitrous oxide, or you could even have the patient use oral sedation with a benzodiazepine prior to the appointment. Benzodiazepine is a drug for anxiety.